So I have just a few slides, and they're helpful because the next little bit is science heavy. I start with a quote from Sir Robin Murray. He is a professor of psychiatry. He's one of the highest, most respected scientists and physicians in the field of schizophrenia. He's, I think, third most cited in the world. And he, most recently in April of this year, has been quoted as saying, "I don't think any serious researcher or psychiatrist would now dispute that cannabis consumption is a component cause of psychosis." So that's really a profound statement. It's something that's really now more and more accepted by certainly the medical community, and I think the general population as well at this point. So let's go on through our slides. The next slide, we'll go through the evidence that we have that marijuana triggers psychotic mental disorders. So what are those? What is that evidence? We know that 12 to 15% of recreational users will report isolated psychotic symptoms like paranoia when they experiment with moderate potency forms of marijuana. And 35% of those with such prodromal symptoms of psychosis can expect to convert to a full-blown spectrum of psychosis if the precipitating factors continue. But the worst statement is that if you have full-blown cannabis-induced psychosis, almost half of people who present to the ER with a full-blown cannabis-induced psychosis will develop schizophrenia. And if you compare that to alcohol-induced psychosis does occur, but it's much more rare. Only about 5% will develop chronic psychosis like schizophrenia with chronic alcohol use. So let's look at the issues of causation from a pharmacological perspective. We've heard this talked about by our own Dr. John Hughes a number of times. And number one, we see a dose-response correlation. So that means with heavier use, more potent products, we see more psychosis. The timing, marijuana use precedes the psychosis, and in prospective studies of teens, that's often something that's seen. Marijuana precedes the psychosis. In individuals who develop schizophrenia who were marijuana users at an earlier stage, that's also evidence that the marijuana is an environmental factor which is contributing to the development of schizophrenia. Marijuana's active ingredient, THC, elicits psychotic symptoms in the laboratory. So if you have a controlled setting of individuals who've used marijuana in the past and you have enough of them, you can elicit psychotic symptoms in the laboratory. Also very good evidence that the THC is the component cause, as Dr. Murray says. In addition, users of other potent recreational drugs developed chronic psychosis less often. For example, PCP users often felt to be a strong hallucinogen, about half of the rate of what we see in marijuana users. So something's going on with THC. And rather than self-medicate, we often see marijuana users with psychosis will try to quit to avoid these symptoms, which are quite unpleasant, hearing voices, seeing hallucinations, whatnot. So one thing that we hear a lot in Vermont is this is just a really small percentage of the population, less than 1%. But when you consider that we've had a series on Vermont Public Radio, This Is Us, we know that mental illness touches so many people in our community. So if that's 10%, if you say 10% of the people have some family member with a severe mental illness, that you're putting 10% of the population at risk. So 10% of the population at risk for the severest of mental illnesses is quite a significant risk. And of course, this is changing daily. So as we move from 2 and 3% THC to a compound that's an extract of 60, 70, 80, up to 90% THC, it's really a different animal. So you're talking about really a new drug, and that's part of the reason we're seeing so much psychosis and schizophrenia, severe mental illness, I guess I should say. And then with heavy genetic loading, there's ample room for environmental factors to make a difference between living a normal life or not. For example, if you have a pair of identical twins and one develops schizophrenia, fully half of the time the other twin will not develop schizophrenia. So we know environmental factors are very profoundly influencing the development of this disease. So, psychosis, schizophrenia, and the stigma of increased propensity for violence. There is some evidence that marijuana uniquely leads to violence when we have people who have marijuana, which is triggering their psychosis and schizophrenia. And there's actually quite a lot of literature, but I think I'm going to take a pause right there. And with that background in the science, I'm going to introduce our next guest, who is Dean Whitlock, and he is a health science writer, and he's done a lot of research into this idea of what percentage of people are going to develop some sort of severe mental illness from being exposed to marijuana. This was really brought out of a quote from Sir Robin Murray, in which he said, there are people who would be well, people with schizophrenia who've suffered suicidality, severe depression, who would be well but for their marijuana use. And it was the profound implications of that sentence, I think, that has motivated people like Dean to take a deep dive and look at what are the costs that come from the mental illnesses that are springing out of the use of a new, strong marijuana by a large percentage of the population, motivated by an industry which is interested in, as Bo Kilmer said, producing a product which is 80% is consumed by 20% of the population, an industry interested in creating people with heavy substance abuse disorder.
In your article, Dr. Roberts, I noticed that there was a concern that you had about and observed a psychotic teenage girl who had been dabbing highly concentrated, potent THC. Can you describe a little bit about what that experience was like, not only for you, but also for your patient?
Well, and I'm even going to go beyond that. It's not just the patient, it's everybody else in the ER. Wow. So if you can picture this is somebody coming in and most people don't have the clear definition of what it means to be psychotic. That means screaming uncontrollably, taking multiple security guards to hold you down and strap you to the bed, sometimes coming in with a spit mask on. And you have, the nice little old lady next door who might be having a heart attack or a stroke or whatever else she's having is now coming to her door to look and see what's going on because there's somebody just screaming absolutely uncontrollably. And I wish I could tell you that was an isolated experience.
Wow.
That happens. To say daily may be a stretch, but every other day that somebody's being brought in a spit mask and needing to be held down because they're completely psychotic is probably almost daily. There was a young man who was supposed to be on a full-ride football scholarship and had a psychotic break. He was at a sort of a training camp and motivational camp, and while he was there had a completely psychotic break, started driving down the freeway going well over 100 miles an hour. His brother tried to chase him down and luckily got him to the side of the road because the car broke down actually and brought him in, and he again he self-reported that he had been dabbing among other things. So again, it's always difficult to say if that's specifically, but I never saw those cases before. But he had been dabbing, and after the dabbing, I followed up 5 days later, and he was still in the inpatient psychiatric ward, and they couldn't get him to keep his clothes on. And this was somebody who was on a full-ride football scholarship.
So the consequences are vast and far-reaching.
And that's the thing that most people don't know about is the psychosis that can come from it. One of the other cases I wrote about in that article was the young man who was seeing ghosts. They're often having very active and vivid hallucinations, and they can run the gambit of what those hallucinations are. And in that specific example was seeing ghosts that told him to kill himself. So he did, and tried 3 times.